Hello friends, I hope you're well. Today we're going to talk about pelvic girdle pain in pregnancy, what it is, why it happens, and what the research says about whether exercise can actually help you feel better. The topic is full of fear-based advice online, but the evidence, as it quite often does, paints a more nuanced picture. So pelvic girdle pain in pregnancy is a type of discomfort that occurs around the front of the pelvis or around the back of the pelvis or both. It often feels like a deep ache, pressure, or instability when moving, walking, turning in bed, getting in and out of chairs or cars. Importantly, pelvic girdle pain is common, with prevalence estimates ranging widely, but often reported in around 20 to 50% of pregnant people in some cohorts. So, what does the science tell us about exercise and pelvic girdle pain? A large systematic review and meta-analysis examined prenatal exercise programs and their effects on pelvic girdle pain, lower back pain, and combined lumbopelvic pain during pregnancy. The key findings were that prenatal exercise did not significantly reduce the odds of developing pelvic girdle pain compared to not exercising. So exercise does not prevent pelvic girdle pain. However, the review found consistent evidence that exercise reduced the severity of pelvic girdle pain when it was present. So in plain English, exercise might not stop pelvic girdle pain from happening, but if you do experience it during pregnancy, being active is linked with less pain intensity. And that is a clinically meaningful outcome. This is important. We are not talking about avoiding pain entirely. We are talking about making symptoms more manageable so you can function better day to day. So why doesn't exercise prevent pelvic girdle pain, but it can help the severity? Pelvic girdle pain has really complex causes. Biomechanical changes, meaning your pelvic joints could be moving differently. Hormonal effects, which could mean ligament laxity. Changes in posture and weight distribution. And neural and muscular adaptations. There is no exercise program that can prevent those biological shifts. But what exercise does do is increase muscular support around the pelvis, improve motor control of the hips, enhance endurance of postural muscles, and reduce fear and avoidance of movement, all of which can make pain less intense and less disruptive. And women who exercised reported better functional status, meaning the ability to do daily tasks. A more recent systematic review and meta-analysis examined conventional exercise programs, including aerobic, strengthening, yoga, and general prenatal fitness, and their impact on both lower back pain and pelvic girdle pain. Pregnant folk participating in regular exercise programs tended to have lower pain scores than those in control groups, even though the difference wasn't always statistically significant. Most importantly, pregnant folk in exercise groups showed improved functional status, meaning they could move, stand, and do daily tasks more comfortably than those not exercising. So again, while exercise might not cure pelvic girdle pain or prevent it entirely, it does help pregnant people manage it more effectively and generally improves how they experience it. There is no high-quality evidence showing that appropriately prescribed exercise worsens pelvic girdle pain in pregnancy. Most of the trials in the reviews found that there was no increase in harmful effects, no evidence that exercise exacerbates symptoms, and no serious adverse outcomes associated with exercise interventions, which I hope does give you a little bit of confidence if you are somebody that is experiencing this. This aligns with broader prenatal exercise guidelines. When tailored appropriately, movement is more often helpful than harmful for pregnancy musculoskeletal pain. These studies included a variety of programs. There was general strengthening, there was walking, there was aerobic activity, there was yoga and low impact movement classes. There is not one perfect program. There never is for anything, but the trend is clear. Consistent, gentle to moderate exercise that engages core, hip, and pelvic muscles tends to reduce pain severity and improve function. And I don't know about you, but I think that is far more useful advice than avoid this or only do that. So why does exercise help? Here's a little bit of science behind it. Muscles around the pelvis are going to support load better. Exercise strengthens muscles like your glutes, your core muscles, your pelvic floor, all of which contribute to joint stability. Improved motor control reduces strain. Better neuromuscular coordination helps the body distribute forces more effectively during walking, standing, squatting, or any other common movement patterns during pregnancy. And exercise reduces fear and avoidance. Research on pain and movement shows that fear strongly predicts disability, meaning people who avoid movement often feel worse than those who stay active but with intolerance. So exercise helps both physically and psychologically. But let's clear up two myths. myths. Myth number 1, exercise will guarantee that you won't get pelvic girdle pain. No, I'm afraid the evidence does not show prevention. And myth number 2, that there is one magical exercise that will fix pelvic girdle pain. No, the data is far too varied and individualized to make that claim. So if you are pregnant and experiencing pelvic girdle pain, what does this mean for you? Stay active, but within your comfort range. Try not to get too scared of movement. Prioritize gentle strengthening and movement that feels supportive. And please speak to your GP if pain is severe or persistent. Exercise most certainly isn't a cure-all, but it is scientifically supported as part of pelvic girdle pain management. Please remember that pregnant bodies are not fragile, they are extremely adaptable, and exercise, when done appropriately, supports that adaptation.